Pregnancy and childbirth is a very stressful time for a couple. Hospitals have been putting strategies in place to accommodate all choices in delivery and childbirth. Your birthing plan should be discussed with your gynecologist or with your maternity unit as to what may be implemented under the guidelines of social distancing. Certain modes of delivery, like water births, will not be allowed in this time of COVID-19. It is best to discuss directly with your doctor or hospital regarding what may be implemented. If both you and your birthing partner are healthy and symptom-free, we always encourage your birthing partner to be present during the labor and birthing process. If both you and your partner are symptom-free and well, we will always encourage a birthing partner to be present during labor and the birthing process. The guidelines of social distancing will be put into place. Unfortunately, no other doulas or family will be present at the time of delivery, and no birthing photographers would be allowed. Each hospital has its own strategy in place. If you are uncertain, contact your doctor or your maternity unit and just check beforehand what is allowed in that specific unit. An induction of labor is the process where medicines are given to a lady to bring on labor contractions. If both you and your partner are well, your partner will be allowed to be with you during this process. Check with your hospital and your doctor beforehand regarding the protocol in place at your specific maternity unit. If you have to have a caesarean section or a instrumental birth inside a theatre unit, your partner will be able to be with you under certain conditions. If both you and your partner are well, then you will both be allowed within the theatre. Now, when a caesarean section is done, we do need to do some sort of anesthetic. In general, most pregnant ladies will have a spinal anesthesia. This is a type of procedure where a medicine is injected into the lower part of the lady's back in order to numb her sensation. And under some circumstances, a lady may need to have a general anesthesia. General anesthesia is when a lady is given some medicine within an IV line and then a face mask with certain gases to then put her to sleep for the duration of the procedure. Now, you will see that in certain hospitals, if not all of them currently, the doctors and nursing staff are now having to wear personal protective equipment, or PPE as it is known. These include face masks and sometimes visors in order to protect the staff against any risk of being infected with coronavirus. Patients may also be asked to have swabs beforehand, before being admitted or before going to theatre, especially if there are any symptoms which could be related to coronavirus. During the procedure of the anesthesia, the partner may be asked to wait outside until that part of the procedure is completed and then may attend during the time of the actual birth. If for any reason baby or mom is at risk, this is during an emergency procedure, then the partner may be asked to wait in the waiting room until the birth is then completed or until mom and baby are both stable. And then every effort would be made for the partner to see baby and mom as soon as they are fully recovered. If you are pregnant and you are now having a new onset cough, fever, or shortness of breath, or you've come into contact that has coronavirus, the first thing to remember is that your symptoms are most likely to be mild. Do not leave the house. Stay at home. Take the necessary precautions of still washing your hands and wearing a face mask, and contact your doctor as soon as possible, or your maternity unit, or phone the COVID-19 national helpline to ask them for further advice. Patients that are very mild will be asked to self-isolate at home for 7 to 14 days. If your symptoms are severe or worsening, then contact your doctor or your COVID-19 helpline or depot as soon as possible, and they may then advise you where to go, as you may need to be admitted. If you are concerned regarding your baby for any reason, that the baby may not be moving or you're having any abdominal pain, contact your doctor first to warn them that you may be coming to the hospital, and they will advise you as to where to report. If you've recently started symptoms that are still mild, remember to contact your doctor and to cancel any appointments that may be scheduled within the next 7 to 14 days. Also inform them that you have now started developing symptoms, especially if you've been there for a recent appointment as well, as they may need to trace contacts. There are designated testing stations in different hospitals, but the test is actually quite simple and involves a cotton swab that is taken either from the mouth or the nose or throat of a patient suspected of having contracted coronavirus. If you have a positive test for coronavirus, you should stay at home and self-isolate if your symptoms are mild. Remember, please, to contact your doctor or maternity unit to inform them so they can also put the necessary changes in place in terms of your follow-up visits and your delivery plan. So the concept of social distancing and self-isolation are very different. Social distancing means that you avoid any social contact, that you only leave the home for essential business or activities. Self-isolation means that you will have to isolate yourself in a bedroom within your house for 7 to 14 days. You minimize contact with the rest of your household, which means that someone else will have to do all your essential business on your behalf. You are not allowed to go to the shops. You are not allowed to go and exercise outside. You will remain in a designated room within your house. It is advised not to share a bathroom if possible. It is advised not to share any utensils with the rest of the household as far as possible. The concept of self-isolation is very different from that of social distancing. With self-isolation, it means you will stay at home at all times. You should not go out to do any essential errands, and should get someone to do these errands like shopping on your behalf. You'll also be asked to avoid contact with members within your household. The best is to identify a room where you could be in complete isolation. Open the windows to that room to allow ventilation. Use your own bathroom if possible. Wash your hands as often as possible. Wear a face mask. Use your own towels, your own crockery, cutlery. You won't be able to make food, so someone needs to do all the cooking and leave the food at the door for you to be able to retrieve it. When you're in self-isolation, remember to contact your doctor to report this to them. They may then delay or postpone your appointments to after your period of self-isolation has come to an end. If you do need to be seen urgently, then your doctor will make arrangements with special precautions in place in order to see you. When you have recovered from the coronavirus illness and your repeat test is then negative, you will be allowed to follow up with your appointments as per normal, and you'll be allowed to deliver as per normal with your partner, but still following the guidelines of social distancing and the preventive measures put in place by your specific hospital. If you are in self-isolation and you have any concerns regarding your baby's well-being, it is advised that you call your doctor or your maternity unit as soon as possible. Don't just rush to the hospital. Call them beforehand so that they can put the appropriate measures in place to accommodate you. Sometimes it may not even be necessary for you to go to the hospital, so rather phone and get the advice. If you are asked to report to hospital, when you do arrive at reception, it is important to inform the person there that you are currently self-isolating at home or have had a positive test so that they could take the necessary precautions. If you're in self-isolation and you start having signs of labor, call your doctor or your maternity unit ahead of time to inform them that you're in self-isolation and that you are now on your way to hospital, so that they can prepare for your arrival. Most hospitals will have a designated area for patients with suspected or confirmed coronavirus for both antenatal and delivery and postnatal. You would notice that when you do arrive at hospital, that the health staff, the doctors and the nurses, will probably be wearing PPE, that is personal protective equipment, during the entire consultation with you, including your labor and your birthing process.